Good evening, everyone. I'm Manoj, clinical psychologist. I have got experience of nearly 20 years in the field. Welcome to this channel of Study Psychology the Easy Way. Our first topic in this channel is going to be on personality disorders. One of the most difficult disorders to be diagnosed when compared to any other psychological disorders, primarily because personality disorders is a set of personality traits which can be also present in a normal person. But till such time that it starts affecting the functional ability of the person, it starts affecting the interpersonal relationship of the person, it starts affecting the inner self of this person, where they start feeling the distress about what's happening, about their behavior, about their about how they relate to the people, how they relate to the society, and also how they are unable to adapt to the situation. Then we can identify them for personality disorders. But when you are going to look into the diagnostic aspects, personality disorder is something that has to be prevalent, that has to be in the person consistently over a period of time, from the childhood through the adolescence into adulthood. That's the reason why personality disorders are very difficult to identify even by the people who are close to the person. So as said in the previous slide, personality disorder is a long-standing, pervasive, inflexible, extreme and persistent patterns of thought, behavior and inner experience, which is manifested as unstable positive sense of self and the inability to sustain close relationship. Long standing in the sense, yes, as I told in the previously, it starts from the childhood, it is existent through the adolescence, and then it goes into the adulthood, and in the adulthood the actual impact of the personality disorder is felt both by the person and also by others. It is also pervasive, yes, it has been discontinuous, progressive, with the intensity increasing as the age increases, because of which they develop the inflexibility, especially in relations to interpersonal relationship, in the relationship with people, and in social situations, and their behavior is also extreme. Sometimes they are the best people to be in contact with, and in a few moments they may just go to the other extreme. They may be the worst people with whom you can get in touch with. So the behavior is also on the extreme, and these extreme behaviors are persistent behaviors which is associated with the thought process of the individual, the extreme thought process of the individual, and also the inner experiences. And how is it manifested? You can very well see that the unstable way in which they feel about themselves and also relate to other people. Sometimes they have a positive sense of self, sometimes it is negative. The same way they have a positive sense of others, negative sense of others, and it is not consistent. It's like the the way they relate to people, it's like when the way they perceive about people is like sometimes the same person would be the best friend for them or the closest relationship for them, and one fine moment they go to the extreme, to the extent of actually feeling that the other person is the worst person they can have in their life. And because of this unstable positive sense of self and positive sense in relationship, they are they find it very difficult to sustain close relationship with people. A personality disorder is a mental disorder in all terms. It can be diagnosed based on the DSM-5, the Diagnostic and Statistical Manual 5, and also by ICD-10, the International Classification of Diseases. And this mental disorder is caused by an unhealthy pattern of thought and behavior. This unhealthy pattern of thought and behavior is nothing but these people try to build a world of their own. and restrict themselves to a world of their own. In the world of their own, they have their own belief system, their own schemas, their own ways how they should relate to the situations and people, which they believe is the best way to go forward with their life and with the relationship. And this makes it difficult for them to understand the social situations and also the relationships, primarily because they look it from their own point of view in a very subjective manner, rather in a just like a in a well, just like they view it in a, as a tunnel vision, where they don't try to look into all the aspects of the social situations or relationship, but they look at only from the viewpoint which they believe and they have constructed in their own world. This actually affects their ability to actually build relationship and also adapt to social life. The personality disorder is characterized by rigid patterns of behavior. As I told in the previous slide, because they look it from a view of the world they have built for themselves, and they believe that the what they have constructed, what beliefs they have about the people and situations is something that is perfect, that is clear. The patterns of behaviors are always rigid, and this actually limits their ability to perceive or relate to the situations and people, because they are unable to actually relate properly to the situations around them and people around them. They find it difficult to enjoy their life, even though they feel comfortable in approaching the people and situation from the world they have constructed for themselves. But still they feel that when they feel that they are not getting the proper results, or when they find it difficult to actually build relationship or sustain relationship, then or have meaningful relationship, then automatically they find it difficult to enjoy their life. And this also affects their normal day-to-day functioning and every functions associated with what they feel is essential for their development. So normally if we see all these behaviors based on whatever is the rigid patterns of thought they have, is always there's a persistent deviation from the cultural expectations. um, Even though they understand what are the expectations of people or what is the expectations of the society, they find it difficult to adapt to the situation. And even though they understand, they know that it is deviant, and this also causes distress in them and makes it difficult for them to function, especially in the relationship with people and in social situations. So what are the characteristics of personality disorders? It's a it's a persistent pattern of thought and behavior that deviates markedly from the expectations of the individual culture. See the deviation, I mean every culture, every people have their own culture, their own cultural standard, their own cultural norms. And if you see, there is a significant deviation from the way the culture of the individual expects the individual to behave. And also it is pervasive, it is consistent, it is progressive, it happens over a period of time. And you can also notice that the people are inflexible, that is they don't try to change their behavior or their approaches to the situation, even when they find that it is deviant from the culture, even when they find that they are not being accepted for the way they behave. And also one of the most important factor associated with the personality disorder is normally the personality disorder has its onset in either childhood and progressively it goes through adolescence, or sometimes in adolescence, or in very limited cases in the early adulthood. And it is stable over a period of time. It is not like, I mean, it is there for some period of time and then they come back to normal, and then they go back to that deviant status. It does not happen like that. The behaviors, the traits, their approaches, the way they relate to people, everything is stable over a period of time. And also, it leads to a lot of distress in the person and also impairment of the functioning in the person. So, naturally, when these factors are present, you can find that some of the key features which is very prominently exhibited in personality disorders. And some of these features are: one, the person has a very inflexible and maladaptive approach to relationship and environment. The person's needs, perceptions, and behavior tend to foster cycles that promote unhelpful patterns and provoke negative reaction from others. So they consistently try to involve in activities or behavior which actually which actually in fact intensifies and promotes the already existing unhelpful patterns of behavior. It also happens in such a way that this can most of the time lead to negative reactions from others. It can provoke other people to also react in a negative way. And if you see, the person's coping skills are unstable and fragile. They find it very difficult to cope with situation. They find it difficult to cope with situation, and and even if they take some attempt to cope with the situation, it is not stable for a long time. It's very unstable. It's very inconsistent, and also it does not. I mean, does not. It does not happen in a very strong way. It's very fragile. They just make an attempt, they just give a try. That too, when there's a pressure from the society or present pressure from the people around them, present pressure from the people whom they feel they are close to them, they exhibit as if they are trying to cope up with the situation, they are trying to bring about changes in the situation, but they never really do it. And naturally, because of all these factors, there's a lack of resilience. And because of the lack of resilience, they find it very difficult to manage stressful situations. So we are going to look at how the personality disorders manifest itself. Normally, we can look at it in the two major areas. One is cognition, the other is affect or emotions. Cognition, yes, the perceptions, thinking, and interpretation of others, events, and self, which is distorted by a pattern of deep-rooted false perception. Here, they go by a belief which has actually formed in them, which they have developed over a period of time based on false perceptions. And this false perception is the is the basic guidelines which actually has a direct impact on the perception, thinking, and how they interpret others' behavior, the events associated with the situations around them, and also their own self, how they are relating to self. Mostly when we are talking about the relationship about self, the false perception is that from their end, they are doing it the right way. From they feel that their approach is right, maybe it is the others or the situations that is actually creating problems. The other important factor where it is actually manifested is the affect or the emotions. Normally, if you observe personality disorders, people with personality disorders, there's a intense emotional intensity. Their behavior, there's a, I mean, most of the time, their behaviors are emotionally charged and happens in a wide range of emotions being exhibited within a short period of time. And mostly these emotions are inappropriate either in intensity or in irrelevance. So how it happens is that you can see suddenly I mean, they exhibit calmness, all of a sudden they become angry or frustrated, they exhibit anger, they exhibit frustration, then sometimes they may immediately shift to a status of sadness, even crying, or just trying to withdraw from the situations. And if you see all these emotions, it is actually inappropriate to the situation. Either it is inappropriate to the situation, or inappropriate in the sense it is irrelevant to the situation. It is not at all totally how a person should be reacting in such situations. Or the inappropriateness may also be in intensity. Where a simple frustration or simple uh, uh, distress is actually expressed in with high intensity of either anger or either sadness, or even if you are going to talk about positive emotions like happiness, the intensity with which it is expressed is very high. And we can also observe that there are a lot of mood fluctuation in the person. The mood fluctuation can be either with a cause or without a cause. The other important area where the personality disorders manifest itself is the interpersonal functioning. We have actually talked about how it affects the relatedness to people and in situations, and how they have difficulty in adapting to the situations. But when you are talking about the interpersonal functioning, the actual way it is manifested is the level of personal boundaries. Sometimes they are very permissive. They allow the other person to get very close to them. They try to interact in a very close, affectionate, intimate, even to the level of intimate manner with the people. And sometimes they express a lot of rigidness. They don't allow people to even get connected to them or develop an acquaintance with them. And in some of the cases, or in rather most of the cases, you can see that it also fluctuates from permissiveness to rigidness. Initially they are permissive in the relationship, they allow the person to get close, and all of a sudden they express, or they go to the level of rigidness, where they try to disconnect from the person, or they try to restrict the person to to a level where they don't get closer, or they are not interacting in a close affectionate way to them. So this both the things happen. And also they have difficulty in getting connected to the emotions of others, and also reflecting the emotions of others. See, because they always see it from their own framework, they don't try to understand what is the real emotions the other person is undergoing. They don't try to uh, empathetically find out what is the status of the other person. They don't try to even um, observe and understand what are the real expression of emotion that is happening from the other person, because of which they find it difficult to connect to the other person emotionally, and also they find it difficult to reflect the right emotions based on what the emotions the other persons are experiencing. And one more important area where the personality disorders are manifested is impulse control, which is poor. They have a lot of difficulty in controlling their impulsive. They have a lot of difficulty in controlling their impulsive behaviors in the way they react to situations, and because of which the person with the personality disorders is at a risk of actually getting injured either emotionally or physically. Both, sometimes the injury may happen to themselves, or sometimes in a fit of anger or a fit of distress, they may just try to harm others people also. Same way, it can be either an emotional harm, or it can be a physical harm. So so what are the maladaptive social responses that you can see in people with personality disorders? One is manipulation. They treat others just as objects, and the relationship are centered around controlling the issues or the person. So it is not that they give any value to the person, any value to the relationship, any value to the emotions or the needs of the other person. They always try to work on the basis of how they can control the issues, or control the situation, or control the person in such a way that they get the best benefit of it, or the they are mostly at the end where they get the best out of the relationship or best out of the contact. And it is mostly self oriented or goal oriented, especially associated with themselves and not people oriented. So they never value the relationship itself, they only focus on how it is going to be beneficial to them, how it is going to help them to achieve their goal. The other part is narcissism, which is again the presence of fragile self-esteem. um, there is a specific personality disorder or narcissistic personality disorder itself, but this narcissism can be seen at a lower intensity or at a different level of intensities in all the personality disorders. And that's where sometimes the personality disorders becomes very difficult to diagnose and categorized under a specific type of personality disorder, because you can see that many of the traits are also present in people in, I mean, one, some of the traits present in one personality disorder is also present in others, only maybe the level of intensity differs. So narcissism is again a manifestation of the fragile self-esteem, the weak self-esteem. So naturally they always look for constantly the constant praise, admiration, and they always have an egocentric attitude of that people should be valuing them, people should be respecting them, people should be admiring them, people should be focusing always on them. And also the expression has a, they also experience a lot of envy whenever they feel that in any social situation, when they feel that they are not given the importance or somebody else is taking the importance or somebody else is getting whatever they expect to get for themselves. So they always have intense feelings of envy when they find that the attention or admiration is going to somebody else. And this also provokes a sense of anger and rage in them when even when they are not actually focused. I mean, the focus is not on them, or when they are not getting the admiration of people, when they are not getting the praise of people, and even when just even in situation where they feel that the other people are not supportive. And they normally, their approach is very impulsive, they don't have the ability to plan, they don't have the ability to learn from their experiences, primarily because they work on a specific belief system, and they very strongly believe that whatever the world they have constructed is the best and the right one. So naturally they limit themselves, they restrict themselves from learning anything new, adapting to situations and trying to actually relate to situation based on the need of the hour. So all these things does not happen. And naturally, because of their work, they always look the world from the world they constructed on their own. There's a poor judgment, and they are very unreliable because of their impulsivity, both because of their impulsivity and also because they are never bothered about what is happening to people around them, or how their own behavior, their own attitude is going to affect the people around them. So because of all these factors and the level of impulsivity with which they function, they also become very unreliable. The coping mechanism usually adapted by people with personality disorders are: one, projection of blame. They try to place the responsibility of their own failures, their own problems, their own distress, primarily on other people, the people whom they are related to, or whom they are in relationship with, and or the external situations. They never try to look into the status that the problems they are expecting, the distress they are expecting, may be because of the limitations or problems they have in the behavior or in the relatedness. In fact, they try to completely put the responsibility for their own failures on others. The other coping mechanism is splitting. they never try to integrate the good and bad of oneself or others, whether it's people, whether it's situation, or whether it's itself. They always look things from the extremes. Either things are good or bad. Either people are good or bad. And sometimes that shift is drastic from good to bad. The people who have been good now maybe the people who are worst after some time, and vice versa. Same with situations. The other important coping mechanism is projective identification. Usually, they try to choose partners who are unpredictable and controlling just like themselves. So, even in most of the situations, they try to repeatedly get into relationship with people, close relationship with people of only this type, even though in the previous experiences or even though over a period of time they have found that such relationship are causing distress to them. And also they try to, on the other side, they also try to relate people whom they have been closely associated with as a child, who had people who had played significant role in shaping their behavior or relating to them as a child. And in these situations, what how they try to be in the relationship is they try to project the childhood experiences on the partner, the problems, the traumas, the difficulties they have faced. They try to just project all the childhood experience on their partner. So what is the prevalence of personality disorders? About see, technically, in a social situation, it is very difficult to identify personality disorder clinically by observing for a short period of time, or even using some psychometric assessments. Either we need to identify a personality disorder from the detailed case history, understanding the complete background, the behaviors, whatever, the way they have been relating to people from the childhood or adolescence, from the case history, from the details we are able to collect from the case history, we may be able to diagnose a person for personality disorder. Or we need to maintain a consistent observation for a period of time before we are able to diagnose a person with a personality disorder. And most of the time, clinically, the diagnosis is happening based on the history. And since the possibility of manipulation by people with personality disorders are high, when they are going to a clinician, when they are meeting clinician, it is, we cannot actually vouch on the status of the actual prevalence of personality disorder based on how much it has been diagnosed by clinicians. However, based on whatever is the current data available, the personality disorders is supposed to be affecting around 0.5 to 2.5 of general population people, and it is actually seen to be higher in inpatient setting, both in inpatient and outpatient setting. It is not like mostly because in a clinical situation we are going to look mostly patients either with other disorders who come to a clinician or a doctor, as a psychologist or psychiatrist. So the rates are seem to be more or less same both in inpatient and outpatient setting, but the clear data of the intensity or the level of prevalence of personality disorders in general population is yet to be actually understood, because no efforts, at least currently, no big efforts have been taken to go into the society and find out the level of the prevalence of personality disorders. And most of the time, many of the people with personality disorders are never considered to be abnormal. They are only treated, or they are only accepted as normal people with some behavior or thought problems. So that is the reason the exact prevalence of personality disorder cannot be identified. And if you are going to look at the origin and cause of personality disorder, naturally it is supposed to be starting from childhood, and it has a chronic course, in the sense it is consistent over a period of time from the childhood into the adolescence, into the adulthood, and naturally, because of its existence over a period of time only, it can be identified as personality disorder itself. And the comorbid factors are usually high. When you are going to look in a clinical population, normally people don't come for a consultation for personality disorder. They either come with depression, anxiety, and when we take the case history or when we try to assess the person in depth with proper psychometric assessment, we diagnose them for the possibility or the presence of the personality disorder. So that's what is happening in personality disorder. If we are going to look into what intervention can be done in personality disorders, the usual approach is trying to actually shift the status of a disorder to a status of style of functioning in the individual. Normally, the psychotherapeutic approaches are found to be very effective in personality disorders. But in most of the cases, in a clinical situation, a person does not come with symptoms for personality disorder itself. They come with the symptoms of some other comorbid problems, comorbid disorders such as depression or anxiety. So the primary work or primary intervention is actually focused on the comorbid status. So when you are going to look at the goal of intervention in personality disorder, it is trying to turn the disorder into a style of functioning in such a way that it is not, or it is reducing the level of distress in the person. It is trying to improve their functional abilities, and also it is helping them to maintain relationship in a way which does not create distress either for themselves or others in the relationship. So it involves it involves a process where the functioning style, the functioning approaches of the person is turned into a style because of which the distress is reduced. So when you are talking about treatment, yes, the primary treatment is for the comorbid conditions, especially the axis 1 diagnosis, for which the person usually approaches the clinician. In the same manner, medications are also used to treat the comorbid conditions, not the personality disorder as such, because in personality disorder, psychological therapies are only can only work out because it is more associated with the personality trait and the functioning based on the personality traits. So mostly the best possible way of actually treating personality disorder is psychodynamic therapy, which is based on the psychoanalytical approach, where the childhood problems underlying the personality disorders are understood and it is addressed in a way helping them to cope up with the distress they have experienced to it, and also through catharsis. And the other therapies that can actually work in personality disorder is the behavior therapy, especially focused on impulse control, especially focused on building good interpersonal relationship, adapting to interpersonal conditions, adapting to the social situations. So behavior therapy focused on these areas, and cognitive therapy, cognitive approaches to change the schema, to change the belief system, to bring about to change the rigidity with which they try to live in the world of their own. So this is a brief introduction about what the personality disorder is and how we can actually identify people with personality disorders. In the coming in the videos which will be following, we'll be discussing about different types of personality disorders, especially the cluster 2 disorders, where you can see which is supposed to be existing in people who are found to be normal in most of the situations. Thank you.